Hey, 𝗙𝗵𝗁 here, and in this video I want to talk about how to improve your techniques, your methodology, and your skills as a physio so that you can ultimately feel more confident to treat more complex cases. Okay, so with complex cases, the secret to this is that strategy is 80% and tactics is 20%. Okay, so how does that help you treat more complex cases? Well, the reality is if you want to treat more complex cases, you're actually going to have to do less treating and more thinking. Okay, and that's where when we actually look at what a lot of people do is they spend a lot of time treating with hands-on treatment. Okay, and then the patient naturally goes back into the real world. There's a mismatch between graded exposure, low tolerance ability of the tissues, and the pain comes back again. Okay, or we do a lot of strength exercise with the patients that don't respond as we expect, and once again there's that mismatch where they avoid loading the tissues we want, they go back into the real world, they develop these habits, and they're very, very hard to change. Okay, and that's ultimately where we need to be able to bridge the gap from low to high level rehab. Okay, because that's where the magic happens. Okay, so how do we do that? Okay, well, we do that by moving from hands-on dominant therapists and strength dominant therapists to a therapist that has structure and systems. Okay, because when we look at our knowledge, okay, and all the knowledge that you've accumulated, you probably have enough knowledge now to treat complex cases. The biggest mistake that you're making is you're not organizing the knowledge, okay, and then deciphering that into the relevant parts of your system. Okay, so what I've done over the years is I've taken all my knowledge and then I've deciphered it into one of these 8 pillars. Okay, so what you're going to find with your complex cases is the majority of the ability to fix the puzzle, it's actually going to be here in the first 4 pillars. Okay, so the strategy. So you want to get really clear on the previous injuries, on the patient's story, where they want to get back to. Okay, so the real life stress in the body. Okay, and then we also want to see what's not doing its job. Okay, so that's where the subject and the objective assessment is going to be so important. And then we need to develop the strategy with the patient by communicating the problem and solution, and then designing a value-based treatment plan for the patient. Okay, so 80% of the strategy, okay, or 80% of the ability to treat complex cases, it's going to happen here. Okay, so if you want to improve your techniques, you need to be improving your techniques in the right places. Okay, and very often for therapists, it's not what you want to hear. Okay, but my job isn't to tell you what you want to hear, it's what you need to hear. Is that if you want to get better at treating complex cases, you're going to need to do 2 big things. Okay, you're going to need to spend more time in the subjective assessment, and then the second thing you're going to do is you're going to need to do less. Okay, you're going to need to stop absorbing knowledge and stop trying to learn off loads and loads of exercises, and have 2 or 3 fundamental movements that you do and understand them so well inside out that you can make small little tweaks or changes to these exercises to put load anywhere you want. Okay, so ultimately everybody needs to be able to squat, lunge, push, pull. Okay, deadlift in some form as well. Okay, that's what we're essentially setting people up for to be successful in life. Okay, so in terms of movements and rehab exercises, you don't need a whole lot. Okay, in terms of hands-on treatment, if we can understand the true stressors, then you treat your hands-on treatment almost like a sniper rifle rather than a bazooka. So rather than needing to treat loads and loads of tissues, you spend more time thinking, okay, and less time executing. Okay, so the more you spend thinking, the less time you have to do the tactics. Okay, so that's where the methodology and the step-by-step system is critical, because knowledge without the ability to organize it and implement it, okay, it's pretty much useless. Okay, you're just accumulating more and more knowledge. Okay, so knowledge has the potential to be powered if you can organize it and you can implement it in the real world. Okay, and that's ultimately why I'm so obsessed with my own step-by-step system, that everything that I absorb now, any knowledge I take in, the first question is, okay, how do I does this adhere to my principles? And if it doesn't, then how can I tweak it to make it adhere to the principles? And the second thing is, where does it sit in the step-by-step graded exposure system? Okay, so if you want to improve your techniques, if you want to improve your methodology and your skills, we need to move away from thinking in isolation and start thinking of a way to organize all of your knowledge and decipher it into a step-by-step system. If you want some help with this, okay, I've got a scorecard that will help you organize your system and show you the potential gaps. Just put a message in the comments below. Just say, yes, please, I'd like the scorecard.